Hi viewers, welcome to Pharma World channel. I'm Hanmantrav Chingmamilla. I'm a pharmaceutical industry expert, and today I am going to discuss about corrective action and preventive action. In simple terms, we can call as CAPA. So, what is corrective action? Action taken to eliminate the non-conformity from the discrepancy observed. The corrective action is the immediate action need to take to eliminate the non-conformity from the discrepancy. For example, if there is any column leakage, so by tightening the ferrule, we can stop the column leakage. So we can avoid the unwanted results from the HPLC. That is the immediate corrective action. Or what is the preventive action? An action taken to prevent the potential non-conformity from the reoccurrence in future. So the action we need to take to prevent the same such type of discrepancy in future. For example, in case of column leakage, we need to revise our pre-analytical checklist by including the checking of column leakage as a pre-analytical checkpoint. So we can avoid this type of discrepancy in future. What is the procedure to be followed for implementation of effective CAPA? This is the sequential steps need to be followed in the CAPA procedure throughout the procedure. CAPAs will be arise from various sources such as OOS that is out of specifications, lab incidents, deviations, internal or external audits, and market complaints if there is any recalls or outcomes of various assessments. So these are all CAPA sources, and any investigations it will be come from any investigations or any discrepancy observed in our routine activities. So, and first of all, we need to describe the CAPA to be implemented. That is description of CAPA, and assign the CAPA actions based on the CAPA evaluation. And CAPA actions, we have to outline the CAPA actions like 1, 2, 3, 4. These much of actions need to be performed to implement the effective CAPA. And the CAPA number will be assigned by QA department and will um, do the initial assessment and give the initial approval for the CAPA actions. And timelines for CAPA will be depends on the nature of the CAPA and criticality of the CAPA. And a cross-functional team and QA department will need to assess the what are the timelines exactly needed for the CAPA closure. So all CAPA must be completed within the target due date. If not completed within the timeline, so extension shall be taken on or before the due date, and the evaluation shall be performed what is the impact due to this extension. And effectiveness check of CAPA. If required, there is effectiveness check for the CAPA which is implemented in the system. So for CAPA effectiveness check, the time period will be based on the criticality of CAPA. And CAPA effectiveness in simple terms, CAPA effectiveness check, the CAPA which is implemented in our system, whether it is effective or not. This is the main motive of the CAPA effectiveness check. For example, we are correcting the some internal parameters in the system as a kappa. So how it could be affect the uh, outcome of the operations. So we need to evaluate certain amount of batches, the changed parameters whether it is have potential impact on the batches or not. So this is the effectiveness check of the kappa. So we can monitor either 1 month, 2 month, or 3 months based on the requirement. So we can prove that this kappa is effective. So until unless Closure of the CAPA effectiveness, CAPA will be open, still open. So after completion of CAPA effectiveness check, CAPA can be closed. Support evidence document shall be attached for the CAPA effectiveness verification for the QA review. Closure of CAPA. Closure of the CAPA. The CAPA shall be closed by Quality Assurance Department after proper verification of all actions completed satisfactory. CAPA log will be updated with closing details and quality metrics shall be updated in line with CAPA log. And for tracking of all CAPAs, there must be a CAPA log to track all the CAPAs. So we can easily track the CAPAs and their activities. So trending of CAPAs. CAPAs shall be trended on monthly basis and quarterly basis to evaluate the open CAPAs and closed CAPAs and void CAPAs and how the system is management in terms of CAPAs. So trending of CAPAs is very important to evaluate the how QMS system, quality management system, is working in our quality culture. So this would be discussed in QRM meeting also. Thank you. Please subscribe my channel for more updates. Thank you so much. Bye.